unnatural and misplaced hairlines, plugs, pits, dents, hair growing at unusual incorrect angles, scarring, decimation of the donor area, disfigurement, unnatural appearance. These are all issues that can be and often are directly related to the hair transplantation industry, past and present. These issues can severely affect self-esteem, one's social and work life, and have a profound impact. I entered the hair transplantation industry approximately 35 years ago, and what I saw truly shocked me. I couldn't believe what I considered barbaric and medieval practices used around the world, giving hair, but the aesthetics I thought were absolutely tragic and terrible, and I think most people also agreed. And the scarring and permanent damage to the donor area was unspeakable. It was logical to me what should be done, and it was a long and difficult process. But at first I wondered, why did doctors resort to such methods, which I regarded as quite primitive? I couldn't really believe it. Why did they do it? Well, because the hair transplantation industry has no regulation, but also it is attracting people where you don't have to work particularly hard, do not need a great deal of skill, and you can make a great deal of money for really not doing much at all, and not having a great deal of conscience does help. But everyone was doing it and getting away with it, and they all backed each other up and protected each other by something that's called the standard of care. That in the medical industry means if everyone's doing it, well, it's okay. It is the standard of care. This concerned me greatly. After all, in the late 50s, 1960s, frontal lobotomy was considered standard of care for bored housewives and depression and homosexuality, until somebody said stop. I came along and said, look, this is a microsurgical process, a microsurgical art form. Follicle by follicle must be removed individually. This was met with enormous aggression, and doctors just didn't want to know about that. Their life was simple. Cutting out a strip in the back of the head took a few minutes, stitching it up, 10 to 20 minutes. Then technicians would chop up that strip like sushi, blocks of tissue containing up to 50 hair per block. Over time, they started saying, well, we should cut a little bit smaller for the frontal hairline. Well, that was really not doing a great deal, but it was some improvement. That was a very, very, very primitive way to do a hair transplant, but it was the standard of care. Extremely lucrative, and it was a production line. Doctors could do multiple patients in one day. It didn't take long, about half an hour per patient. That was it. Once the strip was chopped up, the doctor would come in, draw a hairline, take a punch out the holes, and leave, go to the next room. It was truly a gravy train, in my opinion. And when I came along and challenged it, I wasn't very popular at all. This was something nobody wanted to happen. I said, look, you've got to stop, go right back. Treat this as a microsurgical art form. It requires skill, patience, training, correct equipment, and you cannot promise numbers which, in my view, were quite deceptive. You cannot promise people pencil-line scars, which in many, many cases simply did not happen. You can't protect yourself with these legal disclaimers, which were basically get out of jail free forms. Doctors could get away with anything. Very few people challenged or sued. Some did successfully, but in a production line situation, well, You put aside enough money to take care of that problem, and insurance companies also did the rest. Just prior to the strip excision, there was the big punch method, where huge punches, 10 millimeter, 12 millimeter diameter, were used to go into the donor area, like a cookie cutter. All the hair around the perimeter of that cookie cutter was destroyed, but up to 50 hair could be in the middle, and that would grow. But the results, well, we've all seen it. Plugs, massive, unsightly palm tree type of doll's hair effects. It was absolutely disgusting. And but still, doctors didn't care. We are giving you hair, that's it. And patients, well, the psychology there is quite interesting in itself. Many patients realized what had happened to them. Others were in denial and thought, well, they look okay. And it's a very, very tricky situation. So I came along and certainly upset the apple cart, and doctors started really attacking me. I started showing brilliant results. The internet started happening. Videos worldwide were circulating. I did seminars in Los Angeles and in New York over several years. Multiple publications, radio, television. We did it all. And the whole FUE technique became a phenomenon in itself. Problem is, not many people could do it, because FUE, follicular unit extraction, required microsurgical proprioception. You had to feel your way around the follicle. In a video coming up, I explain on a whiteboard what that actually means. But anyway, we have a lot of topics to cover. The history of hair transplantation, past and present methods and procedures. And I'll plainly say a lot of the deceptive practices that were occurring in the past with the ARB strip and other procedures. Well, a lot of things haven't changed. The mentality and the ethics, or lack of, still continues. The deception with the numbers is a real thing. The damage to the donor area, which is precious and irreplaceable. It will never come back once you've destroyed it. And they are destroying it en masse, from people going around the world trying to find the maximum number of grafts for your minimum amount of money, and it just doesn't work that way. The repair work I'm doing now is becoming horrific. We're just seeing so much of it by people having these mega FUE sessions from around the world. I've argued for many, many, many years that this is not the right thing to do. No one should be in a hurry. You should do this properly and slowly and carefully and get the best result possible with absolute minimal trauma. Well, that's gone out the window with the mega session floodgates opening and people thinking, well, we can get these massive numbers, but none of this is verified, substantiated. People can't see what's actually happening to them in these procedures, and it's a total mess. When I started doing it by hand, and still do, because that's the only way you can remove, in my opinion, the only way you can remove follicles safely, effectively, with minimal damage to the donor area. Back then, 35 years ago and afterwards, everyone was saying, well, Woods is obviously using a drill, because how else would you do it? By hand seems ridiculously hard and long. But I was doing it by hand. The drill, you don't feel which way the follicle is going. The follicle is a floppy banana shape. It's mobile, it's fluid, it moves in 3D. You gotta chase it, basically, very, very slowly. It's like catching a fish, catching a trout. You gotta have the feel. And this is something I found you can't really teach. You've got to understand it and know it. But when people are making enormous amounts of money in the hair transplantation industry, going back to school and starting at square one is not a very attractive option. As far as the FUE mega sessions that have now occurred, well, a lot of doctors felt we are now dropping the scalpel blades and not doing the strip excision. We are doing mega FUE, and they just basically swapped the scalpel blade for a mechanized drill, and they give that to their assistants. And so they drill away to the back of the head, and the transection rate is outrageous. I see people with decimated, destroyed and ravaged donor areas, which is permanent, for what? A sliver of hairline. These are really, really important issues which I must address, and I will address topic by topic over time. And I hope you'll stay with me in this for information that'll help protect you if you are considering a hair transplantation. I'm Dr. Ray Woods, and this is Behind the Hairline.